Our report, Indefinite Despair, contains medical data that reflects MSF's 11 months of providing psychological and psychiatric care on Nauru. Our data show that the mental health situation on Nauru is nothing short of disastrous. In fact, the mental health suffering is among the most severe MSF has ever seen around the world, including in projects providing care for victims of torture. MSF provided almost 600 consultations to Nauruan nationals and 1,500 to asylum seekers and refugees. One of the most shocking findings was the rate of suicidal behaviour. Of our asylum seeker and refugee patients, 60% had suicidal thoughts and 30% had attempted suicide. Being held in indefinite limbo for 5 years with unclear and unjust processes has led to widespread hopelessness and a lack of control that our data found was associated with suicidal behaviour. These people, mostly registered refugees, have little control over their lives, no information about their future, and no forward plan. This is unacceptable, inhumane, and frankly, dangerous. There is no therapeutic solution for asylum seekers and refugees who remain trapped indefinitely on Nauru and Manus Island. We call on the Australian Government to put an end to the policy of offshore processing. All refugees and asylum seekers, men, women, and children, need to be immediately evacuated from Nauru. They must have fast access to permanent resettlement alongside their families so they can begin rebuilding their lives. There is nothing humanitarian about this policy, and it should never be looked upon as a model for any government to replicate.